435 people have died in Milwaukee County of drug-related deaths so far, just in 2021. The medical examiner is saying we are on a pace for a record year yet again.
The pandemic is not helping as families are struggling to find help for their loved ones. SHAUN Gallagher gives us a look at the numbers to see if the problem is getting the resources it needs.
Fighting the drug addiction crisis is an easy cause to get behind, but getting public funding is another story. A volunteer group we spoke with feels it falls on them to pick up where public funding falls short.
This is just right here from like where I park my car to right here, this week alone. If we don't pick them up, the kids are gonna pick them up and play with them.
RAFAEL MERCADO is the founder of Team Havoc, an organization that helps people struggling with addiction. He says during COVID, his team prepared families to deal with overdoses in their homes, even printing materials for kids to understand.
There's no money right now with COVID. Funding is probably 0 to nil.
The city budget allocates $25,000 a year for drug addiction treatment and prevention measures. The city health department says in the last year, most of the money has been spent on fentanyl strips and Narcan, but that hasn't always been the case in prior years. In 2020, they didn't spend any money because of the pandemic, and in 2019, a majority of that money went to advertising. MERCADO believes this message isn't getting to the people who need it, like people scared of the cost of treatment.
$25,000. Rogers Memorial is probably going to take $16,000 of that for one person. And that's just a 30-day stay.
MERCADO says the need is imminent because right now patients are waiting for treatment. 2 providers confirmed with the I-Team they're currently experiencing delays at their treatment centers and are trying to keep up with increased demand.
Unfortunately, a person with opioid or substance use disorder has 3 choices. The first one is recovery and getting better. The second one is death, and the third one is incarceration.
John WEITEKAMP knows what these substances can do to a person. He's a pharmacist, and he sat on the state task force to fight the epidemic. He also lost his son Ben to suicide after his battle with addiction.
That's what was a big surprise. I am a pharmacist. I should have realized something like that, but I had no idea.
His son detoxed on a family vacation. It started a roller coaster journey between getting sober and relapsing.
There was Ben and there was Heroin Ben, and Heroin Ben was really tough to deal with. Heroin Ben lied, cheated, did anything, manipulated. Regular Ben was a loving kid that you always knew.
All the while, they struggled to find the right treatment plan.
There's a lot of different resources that are out there that we can get. The hardest thing is finding them.
WEITEKAMP says there are more options now than when he dealt with his son's addiction 6 years ago, but it was difficult for him to navigate. How do you feel the city's doing right now as far as trying to battle this opiate addiction?
We could do a lot better.
Alderman Michael Murphy sits on a city-county task force to tackle drug abuse. It made recommendations that helped create the Milwaukee Overdose Response Initiative, or MORI, a program through the fire and health departments. They help the same people they treated for an overdose find options to get help. From June of last year until this September, they identified more than 1,700 potential patients. 52 were referred to treatment. During that time, the program was paid for with a $1.2 million grant.
There are some programs that are out there that we know that are working, and they just need additional resources to expand them because there's such a great need and there's just not enough money to do all the things you want to do.
I think, of course, that we feel very limited. A lot of our funding, we rely on grant and federal funding.
Aziza Carter's a public health strategist with the Milwaukee Health Department. She's proud of the work they've accomplished through the MORI program, but says the need has only grown during COVID, and they need more resources.
I think if we had additional funding, we would be able to expand our prevention and response efforts related to MORI, but even go beyond that and really establish like a very comprehensive opioid, response plan for the city of Milwaukee.
A plan that would cover the gaps currently filled by volunteer groups, spending money out of their own pockets.
We're all trying to do what we can here because nobody else is.
Despite the wait time, substance abuse treatment providers say those who need help should still seek it out. If you're looking for a place to start, we have a list of resources on our website connected with this story. Reporting for the I-Team, I'm SHAUN Gallagher.
SHAUN, thank you. Alderman Murphy says additional funds are coming after a lawsuit settlement with Purdue Pharma. You can find more of that interview. Just find this story at tmj4.com/iteam.